Estradiol gel in metered dose pump is a hormone medication that is absorbed through the skin and enters into the bloodstream. It is used by women to help reduce symptoms of menopause, such as hot flashes, and vaginal symptoms, such as dryness, burning, and itching. These symptoms are caused by the body making less estrogen. If you are using this medication to treat symptoms only in and around the vagina, products applied directly inside the vagina should be considered before medications that are taken by mouth, absorbed through the skin, or injected. It is important to use this medication as prescribed by your doctor and to apply it at the same time each day. Before you start using this medication, make sure to read the patient information leaflet from your pharmacist. You should also learn how to use the pump and how to apply the gel correctly. If you're using the pump for the first time, be sure to follow the instructions for priming it. Your doctor will tell you exactly how to use this medication. Typically, you'll apply it to clean, dry skin on the upper arm or shoulder area once a day. Make sure to follow the specific directions for your brand. Avoid applying the medication to broken or irritated skin, the breast, face, or in or around the vagina. And don't let others apply it to your body. The dosage will be based on your medical condition and how you respond to the treatment. It's important not to increase your dose or use this medication more often than prescribed. After applying the medication, be sure to wash your hands thoroughly with soap and water. Wait about 5 minutes for the application site to dry completely before dressing. Cover the area with clothing to prevent others from being exposed to the drug. Also, wait at least 1 to 2 hours before allowing others to touch the skin where the medication was applied. To get the best effect, wait at least 2 hours before showering or swimming to allow the drug to be absorbed through the skin. Use this medication at the same time each day to get the most benefit from it. Avoid getting the medication in your eyes, and if it does happen, rinse them right away with warm water and tell your doctor if you experience any eye irritation. It's important to remember that this medication is flammable until dry, so make sure the gel has dried before smoking or going near an open flame. Keep track of the number of doses used and discard the pump after all the doses are used, even if there is some gel left in the pump. If your condition doesn't improve or gets worse, be sure to talk to your doctor about it. Common side effects of estradiol gel in metered dose pump may include nausea, vomiting, bloating, breast tenderness, headache, or weight changes. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. While many people using this medication do not experience serious side effects, it's important to seek medical attention if you experience any of the following: persistent nausea/vomiting, mental/mood changes, breast lumps, unusual vaginal bleeding, new vaginal irritation/itching/odor/discharge, severe stomach/abdominal pain, yellowing eyes/skin, dark urine, swelling hands/ankles/feet, or increased thirst/urination. In rare cases, estradiol gel in metered dose pump may cause serious problems such as blood clots. Seek immediate medical help if you experience chest/jaw/left arm pain, unusual sweating, sudden/severe headache, weakness on one side of the body, confusion, trouble speaking, sudden vision changes, pain/swelling in legs, tingling/weakness/numbness in the arms/legs, trouble breathing, coughing up blood, or sudden dizziness/fainting. While serious allergic reactions to this product are rare, it's important to seek medical help if you notice symptoms such as rash, itching/swelling of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Estrogens, whether used alone or with another hormone, can have some serious side effects. It's important to talk to your doctor about the risks and benefits of hormone treatment. Estrogens should not be used to prevent heart disease or dementia. Taking estrogens can increase the risk of uterine cancer. Your doctor may recommend taking a progestin to help lower this risk. Be sure to let your doctor know if you experience any unusual vaginal bleeding. In postmenopausal women, using estrogens, with or without a progestin, can increase the risk of breast or ovarian cancer, stroke, dementia, and blood clots. When used with a progestin, estrogens can also increase the risk of heart disease. The risk of serious side effects may depend on the dose of estrogen and how long it is used. It's important to use this medication at the lowest effective dose and for the shortest amount of time. Talk to your doctor regularly to see if you still need to use it. If you will be taking this medication long-term, your doctor may recommend regular physical exams. Before using estradiol, make sure to discuss any allergies with your doctor or pharmacist, as inactive ingredients in the product can cause allergic reactions or other issues. It's important to also disclose your medical history, including any history of certain cancers, blood clots, heart disease, liver or kidney disease, high blood pressure, and other conditions. If you smoke, it's important to note that using estrogens combined with smoking can increase your risk of stroke, blood clots, high blood pressure, and heart attack, particularly if you're over 35. If you have upcoming surgery or will be confined to a chair for a long time, you may need to stop using this medication or take special precautions due to the increased risk of blood clots. Estradiol gel in metered dose pump can also cause blotchy, dark areas on your face and skin, which can be worsened by sunlight. It's important to limit your time in the sun, avoid tanning booths and sun lamps, and wear protective clothing when outdoors. If you're nearsighted or wear contact lenses, you may experience vision problems or difficulty wearing your contacts, so be sure to contact your eye doctor if these issues arise. This medication is not intended for use in children, as accidental exposure to the medication can cause unwanted side effects in children. It's important to keep children away from any unclothed area where the medication has been applied to prevent accidental exposure. If you notice unexpected signs of puberty in a child, such as an increase in breast or nipple size, it's important to contact the doctor right away. Estradiol gel in metered dose pump should not be used during pregnancy, and if you become pregnant or think you may be pregnant, it's important to inform your doctor immediately. Additionally, this medication passes into breast milk and may reduce the quality and amount of breast milk produced, so be sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. This includes both prescription and non-prescription drugs, as well as herbal products. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. There are certain products that may interact with estradiol gel in metered dose pump, such as aromatase inhibitors, fezolinetant, fulvestrant, aspamifene, raloxifene, tamoxifen, toremifene, and tranexamic acid. Additionally, this medication may interfere with certain lab tests, potentially causing false test results. It's important to inform lab personnel and all your doctors that you are using this drug. If someone accidentally swallows this medication, it can be harmful. If they have serious symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include severe nausea or vomiting, as well as unusual vaginal bleeding. Make sure to keep this medication out of reach of children and pets to prevent accidental ingestion. Always use the medication as directed by your healthcare provider to avoid any potential risks. The recommended daily dosage and optimal timing of application will be determined by your physician based on your individual medical needs. Be sure to discuss any concerns or questions with your healthcare provider. It's important to remember not to share this medication with others. While using this medication, it's crucial to have regular complete physical exams and medical tests, such as blood pressure, breast exams, pelvic exams, and pap smears. Be sure to follow your doctor's instructions for examining your breasts and report any lumps right away. It's also essential to keep all medical and lab appointments. In addition, preventing or controlling high blood pressure, high cholesterol, and diabetes can help reduce your chances of heart disease and stroke. Lifestyle changes like reducing stress, eating a low-fat/salt diet, losing weight if overweight, exercising regularly, and stopping smoking can help control or prevent these diseases. Keeping your mind active with mental exercises, such as reading and solving crossword puzzles, can also help prevent dementia. It's a good idea to talk to your doctor about lifestyle changes that might benefit you. For those experiencing hot flashes, lifestyle changes like stopping smoking, dressing lightly or in layers, avoiding or limiting certain foods, spicy foods, caffeine, alcohol, reducing stress, and exercising regularly may help reduce their frequency. Remember, it's essential to consult your doctor for more details and guidance. If you forget to use a dose, use it as soon as you remember. If it's close to the time of your next dose, within 12 hours, just skip the missed dose and use your next dose at the usual time. Don't take extra to make up for the missed dose. It's important to store estradiol gel in metered dose pump at room temperature and away from heat. Make sure to keep it away from open flames, and always store it out of reach of children and pets. When it comes to disposing of this medication, it's crucial not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, you should properly discard the product when it's expired or no longer needed. To do this, consult your pharmacist or local waste disposal company for the best way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.